Isabella seems to be a typical active 5-year-old. She enjoys dance, gymnastics, and swimming, and likes playing with her brother Brandon. To look at her, you would never suspect that something is wrong, but it is. Isabella has a hole in her heart, and it must be repaired, or she will face a severely diminished quality of life as she grows older. Isabella was born with a congenital condition called Atrial Septal Defect, or ASD. Dr. Dan Turner, a pediatric interventional cardiologist at the Detroit Medical Center's Children's Hospital of Michigan, will repair the ASD with an amazing procedure, and he will do it without open heart surgery. Isabella's parents.
When she was less than 3 months old, we went to the doctor for a regular visit. They said she's got a heart murmur. After that, we wound up at a pediatric cardiologist, and every 6 months or so, we were back at a pediatric cardiologist. So we've been doing it since she was 3 months old.
By the time she hits 30, there's like 25% chance of permanent lung failure, enlarged heart, decreased abilities, and that's really significant, and it affects the quality of life, and we don't want that for her. And she's a wonderful kid that likes to do all kinds of sports. We want to preserve her quality of life when she becomes an adult. That's really one of the major reasons why we've had to contact Dr. Turner to do in this procedure.
Dr. Turner's simple explanation makes the procedure easy to understand. The human heart has 4 chambers, 2 upper and 2 lower. The upper and lower chambers on the right pump blood to the lungs to get oxygen, while the ones on the left pump the oxygenated blood out to the body.
There's a wall here between the lower chambers, and there should be a wall between the upper chambers, and there's a piece of that wall that's missing. So the rest of the heart is structurally normal, but there's a hole between the upper chambers.
In the past, a condition like this would have required open heart surgery, but Dr. Turner will use a much less invasive method. He will pass a small device into the heart along a catheter in a blood vessel.
And once you're happy with it, usually we'll sort of push and pull on it to make sure it's not going anywhere, and then you unscrew this from the cable, and then all this comes out, and the patient's left with that device inside their heart. And what happens is the inner lining of the heart, this sort of acts like a scaffolding, the inner lining of the heart grows over the device to make it a complete seal.
On the day of the procedure, Isabella was in good spirits. She knew all about the procedure and was looking forward to getting her heart fixed.
When you wake up, you're going to wonder if we even did it yet. Okay?
I just can't wait till this is over so I can have breakfast.
Are you hungry?
Mm-hmm.
Yeah.
Isabella was taken into the catheterization lab where the procedure would be performed. She was anesthetized, and Dr. Turner began.
So this just goes into the veins. This is the femoral vein now. And then that comes out, and then that little portal of entry allows me to put whatever I need to put into the, yeah.
Using x-rays and ultrasound, Dr. Turner maneuvers the catheter through Isabella's vascular system into her heart and right through the hole between the upper chambers. Then, using a small balloon, he measures the size of the hole.
This side over here is actually the right upper chamber, and this side, the left upper chamber. The hole is where the balloon gets the waste or the indentation in it. We're going to measure the indentation of the balloon here on both of the views, on the front and the side view, because that's going to tell me exactly how big this hole between the upper chambers is.
Next, Dr. Turner removes the balloon catheter and places the device called an Amplatz occluder into position.
I'm going to hold it here, and you're going to watch it begin to mushroom out as I pull this back, and it remembers what it was supposed to look like. So the hole's going to be right where my fingers are, right, and then being sandwiched by both of the sides and with the area in the center there.
When Dr. Turner is sure the device is the right size and correctly placed, he releases it into its final position. With the procedure successfully completed, Dr. Turner uses X-ray images to show Mom and Dad what he did. And today, Tom and Sylvia are ecstatic. More importantly, Isabella is looking forward to a normal, active life in the years ahead.
It feels happy and great to be back. I can run and play now.
Visit us here at dmc.org to learn more about atrial septal defect repair, or to make an appointment with Dr. Turner and his fine team at the Detroit Medical Center's Children's Hospital of Michigan. The DMC. We just think it's a better way to get better. I'm Emery King.